Next, members will take up tab 5, Senate Bill 46, Eye Care for Newborns and Infants by Senator Farmer.
Thank you, Madam Chair. Good morning, members. And Madam Chair, thank you very, very much
Here we go.
For putting this bill on your agenda. I know you do have a very busy agenda, and I appreciate you including it.
And we do have a strike all, so why don't we just go right
So we'll go straight
the
to that.
strike all, because we have so many bills still
Yes,
to
ma'am.
hear.
This bill deals with retinoblastoma. The strike all amendment would provide for...
Let's put it in proper posture first. It says late filed, so members, is there objection to the late filed? Seeing no objection to the late filed, we will present barcode 715644. Now you're recognized to explain the strike all.
Thank you, Madam Chair. The strike all instructs the Department of Health to create and make available to parents and guardians a pamphlet containing information on screening and treatment of preventable infant and childhood eye and vision disorders, including and most prominently retinoblastoma, which is a dangerous form of eye cancer that can easily metastasize to the brain.
Thank you. Are there questions on the strike all, members? Are there questions on the strike all? Senator Bean.
And to the strike call, and thank you very much, Madam Chair. Thank you for bringing the bill forward. There's no more forcing anybody to do anything, or any parents to force them to do the test. Is that right? The strike all takes all that out and makes it optional and makes it where we're just providing information. Is that correct, my understanding?
Madam Chair?
You're recognized.
Senator, that's exactly correct.
It better be.
Further questions, members? Seeing no further, Senator Cruz.
Thank you. I was just curious, actually, Senator Farmer, because the bill that I read just yesterday, said that a parent could file a written objection for these drops. And now today we're down to a pamphlet which simply supplies information. Can you tell me what caused the bill to change so much in a day?
Recognized.
Senator, it's the compromises and collaboration that we do here in the Senate. I think there was concerns about a mandate, as you heard in Senator Bean's question. I think some others had concerns about the parent rejecting, and so we feel that this pamphlet will provide the information necessary for parents to make an informed decision.
Follow-up, Madam Chair.
Follow-up.
So, who will create the pamphlet and who will be responsible for distributing it? I'm guessing in the hospital or the OBGYN's office?
You're recognized.
Yes, the Department of Health will create the pamphlet, and we envision the OBGYNs will provide it upon birth.
Oh, just like the pamphlet they sent me, you pieces of garbage.
We'll work with the department on.
Oh.
Thank you. Further questions, members? Seeing no further questions, we do have one public testimony on the amendment, and we have Dr. J.C. Singh from the Florida chapter of the American Academy of Pediatrics.
Oops.
Be recognized.
The Florida Department of Health gets $800 per student or child that gets immunized, by the way.
On behalf of the American Academy of Ophthalmology and the American Association of Pediatric Ophthalmologists.
I got a pamphlet from the Florida Department of Health about his insurance.
Were opposed to the original bill SB 46.
And the importance of getting the HPV shot, flu shot, etc.
These dilating eye drops in the first few days of the infant's life. These are typically sympathomimetic drops and can have very serious side effects for infants. Once these drops are put in the baby's eyes, it is estimated that about 80% of these eye drops enter the tear duct of the baby and then are absorbed into the baby's bloodstream via the nasal mucosa. And these, once they're systemically absorbed, these have been associated with sometimes life-threatening cardiovascular, respiratory, GI,
Thank God for
and
this
central
lady.
nervous system side effects, like tachycardia when the baby's heart rate goes up, cardiac arrhythmias, skipped heartbeats, apnea when the baby can stop breathing, hypertension when the blood pressure goes up, hypotension, babies can drop the blood pressures. It can cause them to seize. It can cause interruption of the bowel blood supply and cause necrosis in the intestines. So this was the big concern from the ophthalmologists. Retinoblastoma has an incidence of about 1 in 15,000 to 1 in
Amen, girl.
16,000 live births, which
Thank God for
translates
this lady.
to about 600 cases per year in the U.S. and about 4 to 5 cases in the state of Florida per year. The median age for diagnosis is about 18 to 20 months. Average of 12 months.
I need to find this lady and write her a letter
Disease
saying thank
affecting
you.
both eyes, and about 24 months for children with unilateral disease. So we're trying to screen for something at birth that is not even going to be present or going to be visible at birth.
Amen.
Not only that, it's not just the installation of the drops. Once you put the drops in, you're going to be putting in appliances like speculums to force the eye open for the dilated eye exam, which in itself can be damaging if not done
If they don't
properly.
say her name again, I'll look it up and post it.
We do have a protocol for screening in the newborn period. For children that are not at risk, they are examined by a pediatrician or a family practice doctor or an ophthalmologist, usually within the hospital with an ophthalmoscope, and they examine the red reflex. These babies are also examined by the 6 to 12 month period by their pediatrician or healthcare provider with the ophthalmoscope. As a pediatrician, I usually will examine the children every time they come in for their health checkup with the ophthalmoscope and check their red reflex to make sure it's equal on both sides. For infants who have a positive family history of retinoblastoma and are at risk, they are followed very closely by a pediatric ophthalmologist, and they're getting dilated eye exams by a pediatric ophthalmologist, usually under general anesthesia, to get a really good exam every 1 to 2 months for the first 6 to 12 months of their life. And then every 3 months till about age 3.
Holy
and even
cow, that's a
after that,
lot.
they're seen every 4 to 6 months till age 7, and usually about biannually after that. Preterm infants that are again at risk for eye disease, born less than 1,500 grams, are seen by an ophthalmologist to rule out retinopathy. So we feel that universal screening of newborns with dilated eye drops, the risks definitely outweigh the benefits because we're not going to pick up anything additional.
Amen. Thank you.
Thank you. Any questions? Senator Berman, any questions?
Thank you, doctor, for coming. So you mentioned that you were very concerned about it with newborns, and you also talked about the fact that it's often not diagnosed till 18 to 20 months. Would you have any problem with if we change the bill to require that at the 1-year pediatric appointment, they needed to dilate and check for this condition?
You're recognized.
Thank you. I think even putting some mandate like that is not necessary because every child is getting an eye exam at their 12-month checkup.
I will absolutely save it. Absolutely. If it won't let me save the whole thing, I will save this portion for sure.
I can do in my office, put the drops in, dilate, and examine. I'm not trained to do that. In Tallahassee, we have one pediatric ophthalmologist. So I just don't see how we can actually do that and get every 1-year-old screened.
Follow up?
Thank you, Madam Chair, and thank you, Doctor. When you do your ophthalmologic exam, do you turn the lights off in the room, or is it done?
If I do not
You're recognized.
yes, thank you. If the pupils are not large enough, yes, I will turn the lights off so that the pupils dilate and I can get a good exam.
follow-up? What
Yes,
percentage
one of them,
time
46,
What percent
Jen.
of patients would you say you are doing it with the lights off?
You
A
recognize.
fairly
This
small
doctor
number,
is
ma'am,
speaking
less than
against it.
5%.
Thank you.
Senator Book, in questions.
Thank you, Madam Chair.
Oh,
and
look.
Thank you for being here to testify today. You talked about the life-threatening implications and some of the things that can ensue from doing the drops, but what percent would you say?
Oh my Lord, look at her.
These are possible. I actually don't have the data, again, because I'm a general pediatrician. I don't use these drops, so I can't really give you in good faith numbers that would be accurate. I don't have that number.
Further questions, members? Thank you so much, Doctor. Oh, Senator Cruz.
Thank you, Doctor, for being here. I found your testimony interesting, but when you do, the ophthalmoscope examination, do you feel confident that you can see a retinoblastoma?
Yes.
You're recognized.
Yes.
How does it present itself?
It presents itself with irregular reflex, so one may be a lot paler than the other, and there are other reasons for that paler reflex. I have a patient with something called Coates disease, where there's blood vessels that bleed inside the eye, kind of similar, and will present the same way. So anytime I have a red reflex that is not equal, I will turn the lights off. I will look at them more closely. If I don't get a good exam, I will get them in to see Dr. Sherman.
Yep. They actually have posters of that alley in the children's hospitals here.
So, you would do this exam, did you say it's 6 months?
I do them at
You're
every
recognized.
checkup. Sorry. Yes, I do them at every checkup. Like when they come in for that, I would say until age 15 to 18 months. Most pediatricians, it's habit. The first thing we do is we put on the ophthalmoscope, we look at the eye, and then we go on to the otoscope, the rest of the ear, nose, and
Pediatricians
throat
that
exam.
actually care,
Even
yeah.
as kids get older, because we're also looking out for something called amblyopia. We want to make sure both eyes. So when you'll see a pediatrician
Yep.
cover one eye, cover
They
the
have
other eye
pictures
while we're talking
up
to
at the
kid,
children's
because we wanna
hospitals
make
that show
sure
the
no
difference
eye
too of what
drifts.
parents to look at if they see it in a photo.
Thank you very much, Doctor. We
That's actually
appreciate
how
your
my friend's
testimony.
son was diagnosed.
we
She's
have
found it in a
further
picture and brought it to the doctor.
Oh, that is on the amendment. Members, is
Her
there
glasses
debate
are
on the
huge too.
amendment? We are on the amendment, on the late filed amendment. Any debate on the amendment? Senator Book.
Oh
Thank you,
man.
Madam Chair, and thank you, Senator Farmer, for your hard
Go
work on
home,
this bill.
girl.
I know that this was one that I was a prime sponsor on, and
Uh-huh.
we drew a lot of attention for some of the other things that I have going on.
Yeah.
And so you so graciously in our delegation meeting agreed to take this on, and you have worked tirelessly to get this to a place. And I would simply say, I'm sad that we're at a
She's
place
not.
where we're compromising to the point where I'm concerned that kids aren't going to get some of the things that they
You're
need.
not
So,
the doctor.
while I support the amendment.
You're gonna argue with a doctor?
Who have worked so hard to get the bill to this
Like the
point.
one
I'm
that
just
says the
concerned that
doctors know what they're talking about. Now
kids
you're arguing
may
with the
fall through
doctor.
cracks. Thank you.
Senator Baxley, in debate.
Thank you, Chairman.
Ellie.
And I very much support the amendment.
Yeah, of course you
and I have a
do.
blind son. And at 8 months age, you wish you could intervene for everyone. His was a shaken baby syndrome situation.
She is bad
He's now
news.
33.
Bad news bears.
And I can imagine the passion that you have, Senator Farmer, for this, and all the other senators, that we do anything we could to prevent a person losing their vision.
Was your
At
son
the same
blind
time,
due to
I can tell you,
retinoblastoma,
going through
sir?
Infant eye exams is not a picnic. It is traumatic to them. And it is something you have to weigh very seriously about letting everybody poke at and put things in your child. And so I think you're landing in a good place, because you're really raising the awareness that this is something we should be looking for, watching for, and the passion of the family that has gone through this and shared it is very evident, and it's real. And I agree with their motivation. But as a parent, I would not want to be in a position that I'm being told, mandated, that I have to
Okay.
do this to my
That's
child
better.
when I think it's a very low risk compared to things that could happen because of what you're doing. So I think you're really ending in a very good place. This is a very serious illness that if you could intervene early, it's huge. At the same time, parents have to decide whether they want to put their child through that exposure. And I
Amen,
don't
Florida.
want to take
Thank
that
you.
final decision away from them with a mandate. So thank you for this good amendment and for this good bill. I plan to vote for both.
Thank you. Further debate, members? Thank you. You are recognized to close on your amendment.
I'll waive close. Thank you.
Thank you. All those in favor of the amendment, please say aye. All those opposed, nay. The amendment is adopted. We're now back.
Yes.
On the bill as amended. I think we asked lots of questions and we're running out of time. We do have any questions? We do have some public appearance and we're going to have to limit time on these. We have two members sitting here and members with bills on the committee, so we're going to just.
Ally, I'd have to double check
if you would waive in
to see if it
support
was mentioned in the
or,
original bill.
Or opposition. Mary Lynn Cullen from the Florida Institute, the Advocacy Institute for Children. Waiving in support. We have Sarah Jelger Hillis from representing herself.
Here, Lucas, can I have your phone real quick?
Waiving in opposition. We have Carrie Brooks representing herself.
I just need it for.
Waiving in opposition. We have Kiva Ambry. We have Clayton Brooks representing himself. We have Chris Smitham waiving in support. We have Pam Bergsma. I will give you 1 minute, Pam. I know
Yeah,
you're
they
so
wanted to
passionate
limit the
about this
public
instead of
comment
just
because they
waiting.
said they had too many
have
bills on the
members.
docket.
This is not the bill I expected to speak on today, but I wanted to tell you I was grateful. But before I can do that, I have to correct a lot of very bad misinformation that's actually creating needless blindness, eye enucleations, and sometimes death in our children. First of all, this is not about retinoblastoma. It's about making sure every child has the best sight possible. And the number one thing we're looking for in those newborn eyes is cataracts. 1 in every 677 live births is presenting with something that is going to take their sight or worse. That's
Oh,
what the
Lord.
first
Here we
breath of
go,
life.
guys.
1 in 9 newborns is showing a concern. 1 in 10 toddlers has a visual problem, and 1 in 4 school-age children. And it gets worse as you become older, like me. So the most important thing is the use of that ophthalmoscope. And that needs to be used at every well checkup in a dark room, even with our large pupils. The darker the room, the easier to detect. When those lights are on, your chances of seeing something is diminished. And at my age, in my well checkup, this instrument could save my life. It could save yours. But if it's not used, and it's not used correctly, just like a stethoscope for our hearts at every well checkup from birth to 100. Now that tiny little newborn pupil, it just needs the simple little eye dilation, a drop.
It's not
For
simple. You just
decades.
heard
They've
her.
done large national and international studies on these drops. And yes, I can't talk about it, but it's
Thank
all
you
right
so
here.
much. We
These
appreciate
doctors
it.
have never enucleated an eye,
Thank you.
and they have never detected even a retinoblastoma tumor, which the leukoporia glows brighter
Thank
than
you,
anything else.
You're out of order.
Thank you.
Thank you.
And I just want to say thank you on behalf of the awareness, which you promised me back in 2002. Finally, I won't be in the street alone, and maybe this will open the door to more pediatricians doing what we already have from Miami to the Panhandle, doing the eye dilation, and
Thank you.
hopefully those who are not turning out the lights and
Ma'am,
using their ophthalmoscopes will start
We
doing so.
appreciate you being here.
She
Thank
said you're out of order. Goodbye.
you. Next, we'll hear from Mensa Raffin-Spirion. Sorry, I butchered that so badly. Elisa Kolak,
Lisa!
waving. Okay, Drew Martin. Solomí Hernandez, Christine Hemphill. She is in support. Joey's grandma, Pam Bergsman, we saw her. Thank you. We had 2 of those. All right, we are now in debate, members, on the bill. Senator Berman.
Thank you, Madam Chair. Thank you, Senator Farmer, for bringing this bill. I have seen Ms. Bergsma at delegation meetings for the 10 years I have been part of the Palm Beach County delegation. She's a resident of Palm Beach County, and I know the passion that she brings to this, and I know that as we're here in 2020, it was always her goal to be able to discuss 2020 vision in 2020. So I'm happy that we are having this discussion. I am a little sad that we have had to water the bill down so significantly, but I think that for us to be here and discussing it and giving out an electronic pamphlet that will be required will at least get the word out, and hopefully, as Ms. Bergsma said, will be helping all children with vision problems, not just her.
It's watered
not
down
just to address the
significantly
issue of
because you want to
retinoblastoma,
force parents
but
to do something.
amblyopia and glaucoma and all sorts of vision problems. And
Spend your
for
time
that
bringing
reason, I'm
awareness
really
instead of trying to
excited be
force
able
us to do what you
vote
want.
on this bill today. Thank you.
Thank you. Further debate, members. And before we, Senator Cruz.
Senator Farmer, thank you for bringing this bill forward on behalf of a grandmother who's made this her life mission to make sure that other children don't suffer what her grandson has suffered. And all of us here know her because she's walked the halls of the Capitol and is very determined to make a difference. And I vacillate back and forth when I hear the pediatrician talk about a strong medicine that could create all these side effects, and then I think about 1 or 2 lives that we could make a difference in. So I know there's work to be done, and I feel like you've taken the teeth out of this bill a bit with reducing it to just a pamphlet rather than something just a little bit stronger. But I understand the parents that called me too. So many parents called and said, don't mandate a chemical in my, a medication in my newborn's eye. So, I'm not sure what the happy.
You don't know what the happy medium is, really?
So I'm going to go ahead and vote for this pamphlet to move forward, but I hope that all of us don't stop just here. I hope we find something that will actually make a difference. But thank you for
That's
working
not a
so hard
medical
on this bill. I
mandate.
appreciate it.
Find something else.
Further debate, members.
Bring awareness. Spend your
Senator
time doing
Thank you
that.
very much, Madam Chair. And thank you, Senator Farmer, for helping usher this bill through the process. I met Pam one day during Children's Week when my kids were born. And I happened upon her table, and she started talking about retinoblastoma and the things that happened to Joey. And so I was proud to carry this bill for her and for Joey in the year where he would have been 20 in 2020, and we're talking about 2020 vision, as Senator Berman said. Unfortunately, another bill that I was carrying created and drew a lot of attention to this bill.
Yeah, it
And
did.
Drew a lot of ire, and Senator Farmer saw that in our
Wonder
delegation
why.
meeting and took up the cause. And I think that says a lot about fighting for the little guy and making sure that kids are being kept safe. I echo Senator Berman's comments and Senator Cruz. I hope that we'll continue to work on this as we always, try to have a compromise. But again, I think there have been some misinformation.
Medical
and some data
mandates
that
are
can't
not a
be proven.
compromise.
And I want to make sure that we're continuing to not simply just honor Joey's memory, but to
They
keep
want to,
children,
yes.
safe in our state. Thank you, Madam Chair.
Senator Rasan in debate.
Thank you very much, Madam Chair. And I echo the sentiments of my colleagues with their reservations that this got reduced to what it has. And it reminds me of an attempt to create non-opioid directives for patients that got watered down to a pamphlet. being distributed. And I hate that this.
Are you
had to
kidding me
happen
right
to
now?
This bill, because I'm persuaded by the testimony of a very passionate grandmother who indicates that this test, in spite of what Dr. Singh warned,
Dr. Singh was the
could save
pediatrician,
lives,
guys.
could begin early detection that might lead to treatment and healing. I support the bill because I support the concept, but not because I like the way it's currently constituted. So thank you for bringing this good bill forward.
Yep, one grandmother over thousands
Seeing
of
no
us.
further debate, before you close, I would just like to say thank you for working with me on this. I think we're going to have, there will be major awareness of not just retinoblastoma, but additional eye diseases that infants could have. So I really believe that this information will make a difference and will help children. I think it's also a very important element to look at the safety as we move forward.
Amen, Allie.
Again, remembering always do no harm. We want to make sure we're not putting infants, newborns at risk. So thank you so much for working on this issue, and thank you to Grandma Pam for her advocacy on behalf of really making sure our children and our infants really are appropriately treated. So with that, you're recognized to close.
Thank you, Madam Chair, and thank you to my colleagues for your comments in debate. Senator Book, I want to begin by thanking you for the confidence you showed in me in asking or working with me to pick up and take this bill, and you did take on another issue that was consuming a lot of time and bandwidth in your legislative life.
Keep ignoring the elephant in the room. That's fine.
It's been a privilege to take up this cause.
That one's gonna die too.
I don't often invoke thoughts of higher powers, but God bless Pam Bergsma. The tenacity and the passion and the pure love that this woman has shown for 20 years to work on an issue
God bless
that
her,
so
sir.
impacted
If
her
you don't
life
believe in God,
as
what is that
her
worth?
grandson. Last week during Children's Week, I didn't get over to the Rotunda as early in the week as I would have liked.
Amen, Rachel. Absolutely.
And I did get over there on Thursday, and everyone was gone except for Pam Bergsma. She was there with her table. With
She
her
does
chart,
have children, Jen.
with her poster board that I know you have all seen. Pam, God bless you. Your
Means
your
nothing
commitment
from
to
a
this
godless
issue, and,
person, sir.
I happened to walk past Senator Galvano last week. He said, Gary, and we do call each other by name in this process often, and he said, Joey's Law. And then he proceeded to tell me how in his first year in the House was the first year that Ms. Bergsma brought this bill forward. Members, that's just a testament to
Bought and paid
giving
for. Bought and
How
paid
many
for.
times have we told our kids,
Oh, man.
never give up, fight for what you believe in?
You're right, I will.
And so I thank you. It's been an honor.
Fight for
to
my
get to
right
know
for you
and
not to
work
touch
with
my
you.
children.
And with regard to the comments in debate, this process is an imperfect process sometimes, and reasonable minds can differ on a topic, and there can be sometimes conflicting science. There can sometimes be conflicting opinions.
How about I don't want a medical
I know that
mandate?
for many
How is that a
parents,
conflicting opinion?
The issue of a mandate on what to do with your children, how to raise your children, what medical decisions to make for your children. That's something that, offends, concerns, scares many parents.
As it should.
But the thought of
Freaking communist. Goodbye.
life without sight and the thought of
Your mandates are not worth that. Sorry.
and I'm glad, first of all, and let me digress for a minute, I'm glad that it was mentioned about cataracts and the other diseases that this will detect, because I think there was some misinformation out there that there are so few retinoblastoma cases, and so why then take any risk that might be associated with the drops for such a rare condition. But this is about so much more than just retinoblastoma.
The doctor already said none of that stuff is present at birth. There's no reason to do that at birth.
But as I started to say, in this process, you take all these competing interests and concerns and thoughts, and I truly, truly believe that we as legislators are always trying to do what's right and do what's best for the people we represent.
Which is not a medical mandate.
We see bills go through process, and sometimes they change, sometimes they don't.
That's what I was thinking.
We had in this original bill regarding health insurance coverage, and I know that Chair Harrell was supportive of that concept. Candidly, we had a snafu with an initial draft that I submitted, and I take responsibility for that, and we didn't get that language in here in time, but perhaps at that next stop, we can work on that, and we continue to always try to work and improve on legislation that we
Or to fatten your wallet, you.
And so I thank you all for your comments and your thoughtfulness and your support on this bill. I hope that we can vote yes on this bill and at least take a small step forward in the education of parents and the providing of information necessary.
I'm on board
to them
for
to make
education.
informed decisions on behalf of their children, and they always have the
Real
right,
education, not
to
pharma-sponsored
reject,
education.
for their child. That's what being a parent is all about. And so while this bill doesn't quite go as far as maybe we had hoped with the original iteration, it certainly is a step forward, and it's a step forward for young children like Joey, who isn't with us here today, but his memory will forever live on if any child, if any parent is able to get this information and now speak with their treating physicians and get the necessary testing to avoid this horrific disease. Because as rare as retinoblastoma may be, it's a horrific disease in that being an eye cancer and in the nerves of the eyes, it's so close to the brain, and that when not detected timely, it will almost always metastasize into a brain cancer that will take lives. It will take lives. And so hopefully by this measure, even this reduced measure,
The side effects of the medication, the eye drops, will take lives too.
and so I thank you all
More than are taken by retinoblastoma.
favorable support.
Thank you very much. Celia, please call the roll on Senate Bill 46.
Senator Baxley, Senator Bean, Senator Book,
They're voting, guys.
Senator Cruz, Senator Diaz, Senator Hooper, Senator Mayfield, Senator Rusan, Vice Chair Berman, Chair Harrell.
Yes, and by your vote, Senate Bill 46 will be reported favorably. Thank you very much for your
Thank you
hard work
again,
on
Madam
this.
Chair. Thank you, members of the committee. Very, very much appreciate it.
Thank you. Members, I think we're going to go back and take up Senator Simmons' bill. I will be with you guys in just a minute. There are many of us who still have bills to be heard. Senator Simmons.